we continue to see a plateau, kind of holding steady at around 200 cases a day. Today, 203 new cases. Decline in hospitalizations, which is exactly what we want to be seeing. Sadly, another 11 deaths, which is a constant reminder of the toll that this virus is taking on the lives of so many Rhode Islanders. The fact is, I don't know anyone out there who's not struggling right now. In the most extreme case, people who've lost a loved one, but lots of people who are out of work, people who are struggling with physical health, mental health, stress, anxiety. I realize it's a time of unbelievable uncertainty. And so as I've asked you before, today and a Friday, as we end the week and begin our weekend, I want to ask everyone out there to think of one kind thing that you can do for somebody today. And it matters. It's important. It's a time for kindness and patience, creativity, flexibility, a recognition that we're not in this alone. Everybody is struggling in some way right now. So if you feel yourself getting agitated or angry or frustrated, I'd ask you to take a pause and take a breath. And I'd ask you to think of one kind thing you can do for another Rhode Islander today. Look in on a loved one, call somebody, exercise patience when it's difficult, deliver groceries. It's what's going to get us through this. And I have been so impressed by the kindness and generosity of spirit of Rhode Islanders that I have seen every day over the past 2.5 months. Let's hang in there with each other a bit longer. It will be the thing that gets us through this. We cannot change this virus. Nobody wants to be here. We are where we are. We're facing it as a nation. Rhode Island is handling it much better than many other states, and it's our kindness and our strength and our unity that's going to carry us the distance. Okay, today I want to spend a few minutes, as I said I would, talking about how I think about the process of moving in between phases. As you know, about a week ago, I lifted the stay-at-home order. I said that it was time to get out of our houses, reopen retail, construction, manufacturing, parks. Said you could go back into the office for a bit if you needed to. And it is the hope that we're going to get to another phase, and even another phase, and eventually, you know, kind of get out of these phases and get back to, quote unquote, a new normal. The question that so many have asked is, well, how do you know it's going to be safe to move from phase 1 to phase 2? And if you get into phase 2, how will you know whether things are so bad such that you might have to go back a phase? So give me a minute to lay out how we think about it. I will say this. I do have a great deal of confidence. People have said to me, how's it going? It's going well. It's going well because, by and large, Rhode Islanders are following the rules. By and large, we're seeing high compliance with social distancing, not a lot of congregating in parks or family gatherings, as far as we can tell. People are wearing their masks, not everybody. If you're not doing it, I'm asking you to please grab a mask and go ahead and join the club. It's the right thing to do. No, we haven't had any real incidences of overcrowding in retail shops or grocery stores. Nothing that we haven't been able to handle. Retailers have been super compliant. So again, I want to thank you. In general, you should think about a month between phases. So from the start of phase 1 to the start of phase 2, start of phase 2 to the start of phase 3, a rule of thumb is about a month's worth of time, assuming everything goes well. Why is that? Because you start a phase, you make some changes, whatever those changes might be, increased gatherings, retail, etc. You want to do that for about a couple of weeks, and then you need to wait a couple of weeks in order to see the effect of the changes you made. There's no particular magic of 14 days specifically, but we know the incubation period of the virus is such that you want to, if you can, give yourself a couple of weeks to observe the impact of what we've been doing. So for instance, if the fact that we've lifted the stay-at-home order is going to get us into trouble, we won't know that for a couple of weeks from now. And so that's, as a rule of thumb, you could think about phases moving in about a month. So phase 2, assuming everything goes well, ought to start at the very beginning of June, assuming things go well. How do we move in between the phases? So we've decided, after a lot of consideration, thought, consultation, 4 metrics that, taken together, we think paint an accurate picture of the course that the virus is taking in Rhode Island, whether the virus is continuing to decline, plateau, or increase. And maybe we've prepared a slide. If you could please put the slide up. It explains these 4 metrics. The number one most important thing that we are going to keep our eye on as we move through phases is our hospital capacity. This is the thing that we cannot allow ourselves to get in a place where our hospitals get overwhelmed. It's what you saw happen in Italy. It's what you saw happen in New York City and other places. It's a scary place to be, and we don't ever want to get there. It's a challenge, right? Because again, what we're doing today would result in a problem a few weeks from now, so that's why we have to take it slowly. Like these folks, some people are frustrated it's too slow. I get that. I wish it could go faster. Problem is, if you go too fast, 3-4 weeks from now, you could have an overrun hospital, and that's exactly what we want to avoid. So we want to be able to guarantee that every Rhode Islander can have access to the health care they need, including a hospital bed at any time they need, and that our hospitals will never get overwhelmed with COVID patients. I mean, frankly, it's vital that if you, God forbid, have a heart attack, a stroke, you need to get to the hospital, there's a hospital bed and a physician and a care team to take care of you at all times. That is paramount in what we're trying to do here. Currently, about 30% of all beds that could be available for COVID patients are filled. That's about 20% in the ICU. That's great news. It means we have the capacity. I do want to take a second to thank our hospital leaders. They've done an unbelievable job at surge planning to flex the resources they have at each of their hospitals, and they've identified beds for COVID patients while reserving obviously the majority of their beds for non-COVID patients and medical emergencies. If we continue to see less than 70% of beds filled by COVID patients, and the same for ICU, then we'll know it's safe to continue to move to the next phase. If, however, we see a spike in hospitalizations and we end up with 85% or more of beds filled with COVID patients, either in the overall capacity or the ICU, then we may have to scale back. The second metric, relatedly, is new hospitalizations. So, and obviously it connects with the first. New hospitalizations are a good indicator of the trend that we're seeing. What's happening with the virus, increasing, plateau, or decreasing. So for example, if we're below 70% capacity in the hospital beds, but we're seeing a spike in new hospitalizations, that's a sign something's happening and we might not be ready to move forward. At the moment, we're consistently seeing fewer than 30 new hospitalizations a day. Some days it's less than that. So obviously, if it stays at that rate over the next few weeks, it'll be safe to go ahead and move to the next phase. If, however, we get to a place where all of a sudden we start to see consistently 50, 60 new hospitalizations a day, that's a warning sign that we may have to pause. The third metric is the rate of spread. It's a good indicator. It is a good indicator of where's the virus going. Are we starting to climb back up on the curve? And we've talked about this before. Epidemiologists measure the rate of spread with something they call the R value. So you see RT, you might see it in the news, the RT, the R naught, the R value. It all amounts to the effective spread rate. The simplest way to think about it is it's how many people does one infected person infect? So if I'm tested positive, how many other people will I infect? An R value of 1 means just that. It's 1 for 1. Each infected person infects one other person. That's a measure of stability. An R of 1 is a stable place. It's a place that our system can handle. It's a place that all of our systems, the hospital beds, the hospital surge, the testing, the contact tracing, everything, we could handle. An R value of, on the other extreme, an R value of 3, which is about where we were when we started this a couple months ago, that's a scary place to be. That is an unsustainable, scary place to be. That means one sick person is infecting 3 other people. And we estimate that, in March, we were at an R value of somewhere between 3 and 4. Today, we think we're just at about 1, maybe even a bit under 1. That's awesome, by the way. Hats off to Rhode Island. We were in such a scary place, to be honest, and now we're not. Now we're in a stable place. We're just below 1. And as long as we, continue to track that, we'll be in a very good place. So we're going to track the R value. If the R value continues to be around 1.1 or lower, then we think it's safe to move to the next phase. If we start to see the R value edge up towards 1.3, 1.4, 1.5, that means the virus is picking up steam. We're not doing a good enough job with social distancing and mask wearing and such, and we might have to think about going back a phase. I want to be crystal clear about this. The R value, how many people one person can infect, is absolutely in our control, totally in our control. If we wear our masks, that has a big impact on the R value. If we wash our hands, big impact. Stay 6 feet away from folks. Don't congregate. Stay home if you're sick. Get tested quickly if you're sick, and if you're positive, get into isolation. No, if you take a second now, we weren't doing any of those things when we started this 2 months ago. 2 months ago, we didn't know much about the virus. We were trying to wash our hands, but we weren't doing social distancing, the hand washing we need to, staying home when we're sick. We certainly weren't doing testing and getting folks immediately into isolation. We weren't mask wearing. That's how we've gone from an R value of 3.5 to 1. So if we continue to follow these rules, I'm very optimistic that we're going to continue to open our economy. Move between these phases every few weeks without seeing our R value and our hospitalizations creep up. However, if we get out there and start to get lazy or lax, then we're going to get into trouble. And that shouldn't happen, because these steps, although they're frustrating and strange and annoying, we have to take them, and if we do, I think we're going to be in very good shape. Last metric also on the board in front of you is the doubling rate of hospitalizations. So this is a metric you've heard a lot about in the news. I have often talked about it. It's an important way to look at the trends of the virus. Currently, our hospitalizations are stable or even declining, so obviously there's no doubling that's occurring. We were at a place where we were doubling in hospitalizations once every 2.5 to 3 days. That is a very bad place to be. It means the virus is running away with itself. We want to make sure that I fully expect hospitalizations are going to go up. Let me be clear. We're going to start getting back to work. We're going to let the kids go back to camp. You're going to see hospitalizations go up. But as long as it takes more than a month to see a doubling of hospitalizations, we feel confident that we're in a good place and there won't be an overwhelming surge in our hospital beds. If we start to see a doubling of hospitalizations in 15 days, 20 days, then we're going to have to take a hard look, tread lightly, think about putting restrictions back in place, because it could mean we're in a bad place and our hospitals will get overwhelmed. So I would say I hope this is a guide. I hope it's a guide. We look at it all in total. Obviously, we have to apply some common sense. You know, we're not going to say that if suddenly we see 50 new hospitalizations in a single day, that we have to hit the brakes. We're looking for trends. Certainly, if you only have, 5, 10 people in the hospital, a doubling rate wouldn't be a problem. So, we have to, I'm offering these things, the doubling rate and metrics, so you have a sense of how we think about it, but it's common sense. If you go from 10 hospitalizations to 20, that's not an emergency. And then the last thing is, all of this is overlaid with an assessment of our systems. Are we where we need to be with testing? Are we testing people in the inner city? Are we testing vulnerable communities? Can we get to an outbreak in a facility quickly and get it under control? Is our contact tracing working? All the systems that we've set up. So I hope that it is clear or clearer how we're thinking about it. I will tell you now, our systems look great. Testing, contact tracing, PPE, all the masks, ventilator supplies, hospital beds. The systems we've developed are strong. They're in good shape, and we're going to continue to make sure that that is the case. I will say, I look forward to moving to phase 2, right? We started phase 1, and May 8th, I want to get to phase 2 very early in June. And then hopefully, knock on wood, very early in July, we'd be moving on to phase 3. And what we want to do in each phase is make changes and then hold steady on those changes. Observe them. Hopefully everything is in accordance with the metrics. Make some more changes, observe them, and then move on. The thing we really have to prevent is overwhelming our hospital system. We just don't want to ever get to a place where somebody can't get a hospital bed and they need it, or can't see a doctor, et cetera. Okay, 2 other quick points, both important, but I'll be brief. I want to make a special mention of a town hall that we're having for older adults. Next Thursday at 11 a.m., I'm going to be hosting a Facebook Live for older Rhode Islanders and their families and their caregivers. I'll be doing this in collaboration with Secretary Robertson, the U.S. Assistant Secretary for Aging, our own HHS Secretary, Womazetta Jones, and Rose Jones, who runs the Office of Healthy Aging, as well as several other community advocates. I would encourage you to listen in, to send us your questions in advance. You can submit a question to us at communications@governor.ri.com, and I look forward to it. This is a really hard time for older adults. You're the most vulnerable and susceptible. You have to be careful, but yet also you want to live your lives. You want to have access to the support you need, the food and medicine that you need, the health care that you need, transportation that you need. I know it's an anxious time. I hope that this town hall gives you a chance to tune in, ask your questions, be with other people that have questions just like you, and it's our hope that we can help allay your concerns and provide you with support. Finally, as a reminder, Monday is the day by which businesses that are reopening or are already open need to have their COVID-19 control plan complete. There's an easy-to-use template online at reopeningri.com. You do not have to submit your plan to the state, but you need to keep it on file. So I'm trying to make this as easy as possible for businesses to comply. So there's a little bit of an honor system here. We are asking you to go online, reopeningri.com, look at the template, create a comprehensive plan for your business. If the inspector comes, you'll be asked to produce your plan, but we're not asking you to submit it in advance to the state. We're trying to balance public safety, public health with business friendliness, and I hope that I hope you find it to be a good balance.